message from the Ministry of Health. COVID-19, otherwise known as the novel coronavirus, is changing the way we live, work, and do business in Bermuda. It's also changing the way we shop. As a supermarket, you are providing an essential service, and there are a few things you should know about what you can do to help protect our residents and keep our community safe. Communicate with your customers the steps your business is taking to protect against COVID-19. Educate employees and customers on Ministry of Health recommended hygiene procedures, which can be found at coronavirus.gov.bm. Schedule specific hours of operation for vulnerable populations to shop without other customers. Expand remote shopping options if available. Click and collect, delivery, pickup, or shop by phone. Ask customers to implement social distancing at all times in the store by keeping a minimum 6-foot distance between each person. Close salad bars, buffets, and other ready-to-eat or sample offerings in stores. Institute purchasing limits on high-demand items and household staples, for example, toilet paper, hand sanitizer, and cleaning products. Implement policies and procedures for prompt identification and isolation of sick workers. Ensure that all staff are aware of the reporting requirements should this be needed. Require any employees who have respiratory symptoms to stay at home. Update and communicate your sick leave and paid off time policies to your employees regarding COVID-19. Encourage frequent hand washing. Increase or add hand sanitizing stations around your stores for customers and employees. Employees must be encouraged to sanitize their workspaces thoroughly throughout the day with a cleaning solution containing at least 60% alcohol. Mandate the wearing of protective face coverings, such as cloth masks, by staff. Implement your business emergency response plan. This should clearly outline what to do in the event of any foreseeable emergency, including an infectious disease outbreak or pandemic, such as COVID-19. Institute additional mandatory cleaning and sanitizing schedules for high-touch areas. Assign employees to regularly sanitize shopping carts and other high-traffic or high-touch areas. Identify hard-to-cover positions and implement cross-training to prepare for coverage issues. Stay in communication with health officials from the Ministry of Health and make sure your company is receiving their regular updates. Many of these things you are already doing and have been doing for quite some time. And we at the Ministry of Health thank you for doing your part in safeguarding our community from this threat. Stay informed to stay well, Bermuda. A message from the Ministry of Health.
Good afternoon, and a pleasant Friday afternoon to all of you. Today at our press conference, I am joined by His Excellency the Governor, who will provide information on the next Airbridge flight to United Kingdom. I'm joined also by the Minister of Health, who will provide an update on COVID-19 cases. The Minister of National Security will provide an update on the revisions to our shelter in place, changes which will come into force on Monday, and also by the Honorable Attorney General, who will provide an update on the Department of Child and Family Services, in addition to information regarding domestic violence. We continue to pray for the health and safety of those that have contracted COVID-19 or who have lost loved ones to this virus. Our hearts are with you, and we pray that you will recover swiftly and that the friends and families of the people we have lost are finding comfort in their time of grief. COVID-19 has brought tragedy. Each other. It has also brought forth innovation and flexibility in thought and deed. Today, that innovation and flexibility was demonstrated, and Bermuda made history as we held the first virtual session of Bermuda's legislature. This session, held over WebEx, enabled the 35 members of the House of Assembly and the 11 members of the Senate, under the watchful eye of the Speaker of the House and the President of the Senate, all without breaking shelter. Through it, and we accomplished the work we set out to do. Parliament today voted to continue shelter-in-place regulations until 6 a.m. on May 2nd, and for the state's emergency order to be maintained until June 30th. Some may have interpreted this to mean that we intend to remain with shelter in place in force until the end of June. That is not the case, so let us please kill that rumor right now. We have every hope and every expectation that we could emerge from the shelter in place on May 2nd. And the best way to ensure that happens is for people to only leave their houses for essentials and to maintain proper social distancing while you do. Recognize even if you go to your neighbor's house and talk to your neighbor without face coverings and otherwise, you're putting yourselves at risk and putting the hard work that we've had for the last 2 weeks at risk as well. We are, however, in uncertain times, and the government may be of this very aggressive virus. Under our existing laws, the only way that we can have the appropriate protections to prevent the spread of this virus is via a state of emergency. It is imperfect, and I don't like it. To remedy this, we will be bringing forward legislation to allow this and any future government to implement appropriate measures to manage a pandemic without the need to declare a state of emergency. Once this amended law is drafted, passes both houses of the legislature, and receives its assent from the governor, the cabinet will act for the as the new laws will give the government the of a pandemic. This government feels for the many students and Bermuda residents that remain stranded in the United Kingdom and around the world. In order to assist in remedying this situation, the Cabinet Office, in conjunction with Government House, has arranged for another flight from the United Kingdom. It is important to note that this flight is only for persons who are ordinarily resident in Bermuda. That means students and those who may have been stranded outside of Bermuda from their travels. It is not for persons who relocated to the United Kingdom who wish to relocate to Bermuda. Also, it must be noted that persons returning will be in government quarantine facilities. For further information on this Airbridge flight, His Excellency the Governor will now give remarks. HG.
Thank you, Premier. Let me start by expressing my own condolences to those in Bermuda who have lost loved ones as a consequence of the COVID-19. Prayers to Ireland are with you now and in the days to come. At the same time, I again pay my tribute to all the medical, nursing and health staff who continue to work so hard to tackle the outbreak, and to the men and women of the Royal Bermuda Regiment and the Bermuda Police Service, together with many others. Yesterday, I and the Deputy Governor visited the homeless shelter at Cedar Bridge and saw for ourselves the good work being carried out by the Health and Family Services staff there and by members of St. John Ambulance, assisting our homeless population. That is just one important example. I know there are many others playing their part across the island to help those in current need. Following the resolutions passed earlier today in both houses of the legislature, I have signed a notice confirming that the shelter-in-place regulations will continue in effect until 2nd May. These regulations, which maintain the nighttime curfew and set out the arrangements for essential daytime visits to grocery stores and pharmacies, continue to have my support, precisely because they help to limit community transmission, flatten the curve, and crucially, help to reduce the level of demand on the hospital and its staff. I'm also pleased to confirm today, as the Premier has indicated, that with the assistance of the Foreign and Commonwealth Office, a second Airbridge flight from the UK has been organised for Friday, 24th April. The British Airways charter flight will depart from Heathrow Airport, land in Bermuda, and then return back to London on Saturday, 25th April. This flight will have three purposes. First, to bring back those ordinarily resident in Bermuda who are currently in the UK, with priority again being given to young persons and vulnerable people who need to get back home. As before, all those coming in on the flight will be required to stay at a government-approved quarantine facility for the minimum 14-day quarantine period. Secondly, people currently in Bermuda who are ordinarily resident in the UK and who want to get back there will be able to book places return flight to them. Other than the UK will need a valid onward ticket to their destination, or they will not be permitted to travel. The cost of each leg of the flight, either from London to Bermuda or from Bermuda to London, will be £500. The third purpose of the flight, and just as importantly, is that it will bring with it further COVID-19 medical supplies and protection equipment for Bermuda, as well as other pharmaceuticals and essential medicines which are required here. Those wishing to travel from Bermuda to the UK on 25th April should contact officer at Government House, whose email address is executiveofficer@gov.bm. That's executiveofficer@gov.bm if you are in Bermuda and wish to get the return flight back to the UK. And I'm grateful to all my staff at Government House, as well as to the Bermuda Government Office in London, for all their work in helping this flight to take place. Finally, let me join in thanking the vast majority of people on this island who understand the continued need for the social distancing and other shelter-in-place arrangements which are still. They are a disruption to normal life. I know they're not easy, but they help to keep us safe and are the best way forward for helping us to return in due course to a more normal way of life, to which we are all looking forward. Stay at home and stay safe. Thank you, Premier.
Thank you, AG. As the governor mentioned, Bermudian students and Bermudians ordinarily resident in Bermuda will be returned to Bermuda. That will departing from London Heathrow on Friday. The London office will be in contact with those persons who are eligible for the flight, and there is no further need to contact the London office as they already have the list of persons who have made themselves known. Next, I will turn the podium over to the Minister of Health, Minister Kim Wilson, to give an update on COVID. Minister?
Thank you, Premier. Good afternoon. Today, there were 20 test results received, and I'm pleased to report that none were positive. There were also no additional hospitalizations and no additional reported deaths for today. As such, Bermuda's total confirmed positive cases stands at 83. Their status is as follows. There are 43 active cases, of which 34 persons are under active public health monitoring and 9 persons are hospitalized. A total of 35 have now recovered, and the total deceased remains at 5. The average age of all of our confirmed positive cases is 56. The median age is 58, and the age range of all of our positive cases is from 18 years to 91 years of age. The age of persons hospitalized ranges between 67 and 82 years, with the average age being 74. Of the 83 positive cases confirmed to date, 37 are males and 46 are females. While there were no positives today, every new case we discover is a disappointment and a worry to us all. However, our mitigation strategies helping us to contain the situation are bearing good fruit. We acted quickly as a country, and we are in a stronger position for it. Just this week, Public Health England confirmed that our case vigilance and preparations for rapid case identification, case isolation, contact tracing, and PCR testing are appropriate and proportionate. Today, I want to thank another group which has been working exceptionally hard. Crisis response team. This week, they allocated funds to the private and charitable residential care homes for additional food and non-medical supplies. Each home has been allocated $100 per resident per month, which can be used at Butterfield and Vallis. These funds will not and are not intended to cover the full cost of food and non-medical supplies. They are in addition to support each of the homes at this time. This will be for 2 months initially, to be reviewed as things progress. This initiative will ensure that each home has a stable supply line. It will also limit the number of outsiders delivering to the homes and limits or even ends staff going to stores, which aligns with the recent guidance from the CMO and the Ministry of Health around shielding our most vulnerable persons. Additionally, it frees up care home staff to focus on other critical work. The process is straightforward. Each home will have an emergency fund account at Butterfield and Vallis. The funds will be prepaid into the assigned account by the Bermuda Community Foundation. Thank you also to the Bermuda Health Council for helping to coordinate this process. And today I have another update regarding the Bermuda Health Council. Some of you may have seen the COVIDIQ.net online data collection tool, which collects and depicts public health data around the island. I can announce that the Health Council is working with developers to make some evidence-based enhancements to the platform to serve as a broader public health data collection tool to help inform health policy and strategy in order to improve the health of the community and reduce social determinants of ill health. The more local data we have, the better our chances at getting the right resources to the right places at the right times. And this is definitely providing true as we navigate through this COVID-19 crisis. And it should be up and running shortly. One question which I have heard asked quite a lot for the past week is, as most of you know, currently there are no proven treatments to cure COVID-19. However, the standard of care for COVID-19 is supportive management, oxygen supplementation, IV hydration, and non-evasive or evasive ventilator support. Sometimes COVID-19 can lead to bacterial superinfections and hemodynamic instability, which can be treated with antibiotics and medications to elevate blood pressure, respectively. In select cases, patients may be offered other medications if a physician believes the potential benefits outweigh the risk based on limited evidence. Such cases would require informed consent by the patient or the patient's designated representative after a robust discussion regarding the potential risks and benefits of the offered treatment. In closing, I wish to thank international and local businesses in Bermuda who have collectively raised $1,044,000 to date for essential medical supplies and equipment, including personal protective equipment and ventilators. I'm really proud of how Bermuda's insurers, reinsurers, brokers, investment managers, local insurance companies, financial service companies, medical associations, as well as private individual donors have come together to support the hospital at this time. We thank you very much for your support. Thank you, Premier.
Thank you very much, Minister of Health, and it's great news to know that there are no new cases reported today. When shelter in place was first enacted, we had hoped that 2 weeks would be sufficient to achieve our objectives. Regrettably, this is not the case, and we've had to extend until May the 2nd. During this period, we have been humble enough to listen and flexible enough to recognize that some of the aspects of our previous regulations would need to be revised to help our island get through this next 2-week period so that we can be as productive and as healthy as possible. Minister Keynes will provide an update on the new regulations for shelter in place, which will go into force on Monday, and on the activities of the Bermuda Police Service and the Bermuda Regiment. Minister Keynes.
Good evening to our listening audience. This evening, I will share an update regarding the proposed changes to the emergency policy. These amendments will come into force on Monday, April 20th, 2020. The following businesses will be allowed to have limited operation under very restrictive terms to be specified, including roadside sales by a licensed fisherman, roadside sales by a registered commercial farmer, laundromats, pet shops, hardware stores, including paint stores, plant nurseries, shipping and freight companies, couriers, and delivery persons. Pest control. Persons engaged in pest control, subject to the supervision of the Chief Environmental Health Officer, will be permitted to attend calls to required businesses. More details will follow. Tobacco and wholesalers. Alcohol and tobacco wholesalers. Persons engaged in the wholesale distribution of grocery stores of alcohol and tobacco products will be allowed to restock these businesses on a limited basis. These days will be Saturdays, Mondays, and Tuesdays. More details to follow. Grocery stores and gas stations. Visits to the grocery stores or gas stations will be changed, and it is important for the public to carefully take note of the following changes. Mondays and Thursdays shall be for persons whose surnames begin with the letter A to F only. Tuesdays and Fridays shall be for persons only. Wednesdays and Saturdays shall be for persons whose surnames begin with the letters R to Z only. Sundays shall be reserved 55 years and over, disabled persons, and essential workers, and workers not required to work from home. The persons that I just mentioned may also shop on the day that corresponds with their last names, in addition to being able to shop on Sundays. Laundromats. Laundromats may only operate with written permission of the Minister of National Security and shall meet the following conditions. Opening hours from 7 a.m. to 7 p.m. Monday to Friday only. Only one customer to be allowed in the laundromat at any time, and attendance can only be made by appointment. Wash and fold services may be provided as long as customers are not permitted to enter the premises during the drop-off or collection of their laundry. Pet shops. Pet shops may only operate with the written permission of the Minister of National Security and shall meet the following conditions. Pet shops must operate to 5 p.m. Monday to Wednesday only. Mondays shall be for persons whose surnames begin with the letter A to F only. Tuesdays shall be for persons whose surnames begin with the letters G to Q only. Wednesdays shall be for persons whose surnames begin with the letters R to Z only. Hardware stores. Hardware stores may operate with the written permission of the Minister of National Security and shall meet the following conditions. Customers shall not be permitted to enter the store, but will have curbside pickups only. Collection of prepaid goods is permitted from 9 a.m. to 5 p.m. Mondays shall be for persons whose surnames begin with the letters A to Tuesdays to Q only. Wednesdays shall be for persons whose surnames begin with the letters R to Z only. Plant nurseries. Plant nurseries may only operate with the written permission of the Minister of National Security and shall meet the following conditions. Customers shall not be permitted to enter the plant nursery. Collection of prepaid goods is permitted from 9 a.m. to 5 p.m. Monday to Wednesday only. Monday shall be for persons whose last names begin with the letters A to F only. Tuesdays shall be for persons whose surnames begin with the letters G to Q. To any undertaking of a taxi driver to be on the road. Please contact any of these matters critical services at gov.bm. Critical services at gov.bm. The rules of the courier delivery companies are as follows. A person making a delivery shall not enter a customer's home, but shall leave the goods outside of the customer's door and telephone to inform the customer that the delivery has been made and shall maintain the appropriate social distancing at all times. The deliverer must use hand sanitizers, wear the appropriate protective equipment, and follow the guidance as issued by the Ministry of Health. Thank you.
Thank you very much, Minister of National Security. The next minister to speak will be the Honorable Attorney General and Minister for Legal Affairs, the AG, Minister Kathy Lynn Simmons. AG?
Thank you, Premier. Good evening, Bermuda. In this time of unprecedented and profound uncertainty, community welfare agencies face challenges to ensure the safety, well-being, and permanency for our vulnerable citizens and their families. The government of Bermuda understands the stress that many families have to bear while we shelter in place. We remain grateful to our third sector and charities who provide protection, accommodation, and support for our families and vulnerable members of the community. As the public health crisis persists, we must critically assess and safeguard the needs and rights of minor children and their parents who are the subject of court-ordered arrangements, in particular, the existing law under Regulation 3.3 of the Emergency Powers COVID-19 Shelter-in-Place Regulations 2020 provides that for the avoidance of doubt, a minor child of parents who do not live together shall remain at the home where the child is living on commencement of these regulations until they cease to have effect. This provision has given rise to practical challenges for some parents who fall within this category. As the government continues to be responsible its citizens. I can report this evening that in consultation with the judiciary, we are in the process of considering amendments to the regulations to address practical issues that have arisen for parents who share parental responsibility for minor children and who do not live in the same house, as the state of emergency and its accompanying restrictions have been extended. More information will be shared with members of the public next week. During the month of April, the ministry commemorates several observances. This month, we will typically focus awareness on National Child Abuse Prevention, Sexual Assault Awareness and Prevention, and the International Week of the Young Child. While we have not had the opportunity to recognize these observances, I wish to thank our community partners for their unwavering support. We appreciate the services of the Center Against Abuse, SCARS, the Coalition for the Protection of Children, the Family Center, and other charities who work with us to assist our most vulnerable citizens. We know that during this extended shelter in place period, children in abusive situations may be more susceptible to incidences of sexual abuse, physical abuse, and neglect as they remain in their homes. Should anyone in the community have concerns about the welfare of a child, please contact the Department of Child and Family Services on-call social worker on 332-00, on-call supervisor or the on-call supervisor at 335-9095. If it is an emergency, please call 911. Since March 24th, the Department of Child and Family Services has received 18 new referrals requiring investigation. There have been 10 children exposed to domestic or family violence, one child exposed to moral danger, which means that the child has been exposed to unsafe behaviors such as drug trafficking, prostitution, theft, criminal behavior, and/or individuals engaged in active abuse of illegal substances. We have one report of lack of supervision, two child on child sexual abuse reports, two reports of physical abuse, two referrals for parents abusing substances. Investigations are underway, and DCFS workers are making contact with the parents to ensure that safety plans are in place. All conferencing and telephone calls. DCFS has assisted in providing groceries and medication supplies to families and linking families to community resources such as the Eliza Doolittle, the Lauren BNTB Initiative, Women's Resource Center, and the Coalition for the Protection of Children. Clients are given information on how to talk to their children about COVID-19, in addition to activities that they can do with their children. The Foster Parent Association is also gearing itself to assist foster parents who may be struggling through this period. The Department of Child and Family Services will continue to work closely with the third sector partners as well as public health partners to respond to calls for assistance. The public is reminded that domestic violence that involves adults only is referred to the Center Against Abuse and or the Bermuda Police Service. Since March 30th, the Center Against Abuse has reported that they answered over 34 calls on their hotline, worked with 5 clients to complete filing 6 domestic violence protection orders, and assisted 4 families with safe shelters. Between March 23rd and April 13th, the courts have issued 13 domestic violence protection orders. The public is reminded that the Center Against Abuse operates a 24/7 hotline for victims of domestic abuse and sexual assault. The center's hotline number is 4366. We share the concerns of the Center Against Abuse and note that there are persons in our community who are in abusive situations but are not ready to take the step of leaving their abusers. In such situations, the center recommends the following safety tips. Be very aware of your partner's mood, and when you see it changing for the worse, if you can, get out of the house to a safe place. Identify safe spaces in your home that you can go to should an argument break out. such as rooms without windows, with windows, I should say, and doors, spaces without weapons, such as knives and bottles. If violence is unavoidable and you are stuck and cannot escape, crouch right down on the floor and curl up into a small ball on the floor with your face towards the floor, your hands over your head, and your elbows covering the inside of your face. The sides of your face, I should say. If possible, always keep your phone on so you can call 911. Ask a neighbor to call 911 should they hear anything from your home. Ask your children to call 911 should they hear or see any abuse. Set up a secret code word like RONA, that's RONA, or any word, with a close friend or family member that you can send to them so they know that it means to call 911 for you. Teach your children to get out of the house safely. If you can, reach out and talk to trusted family and friends to release your stress. And lastly, you can search safely online for counseling assistance with the Center Against Abuse via info@centeragainstabuse.bm. To every woman, child, and man, it is important to note that nothing that a victim does deserves any abuse from an abuser. We encourage anyone in the community in need of assistance to review the Third Sector Crisis Response Essential Services contact sheet, which provides a list of available help and support resources at www.gov.bm/coronavirus. We urge you to stay informed and vigilant. Do not live in an abusive situation. There is help available as previously stated. Please reach out to us. Thank you.
Thank you, Attorney General. I've been informed that at the beginning of this broadcast that some persons did not receive all of the information. So I'm going to briefly recap some of the stuff that I said at the beginning because it's important information that all persons need to know, and then we will move on to questions. Parliament today voted to continue shelter-in-place regulations until 6 a.m. on May 2nd, and for the state of emergency order to be maintained until June 30th. Some may have interpreted this to mean that we intend to remain in shelter in place until the end of June. That is not the case, and let that rumor die tonight. We have every hope and expectation that we can emerge from shelter in place on May 2nd. And the best way to ensure that happens is for people to only leave their houses for essentials and maintain proper social distancing when you do. We are, however, in uncertain times, and the government needs to have the flexibility to quickly enact restrictions that may be necessary to control the spread of this virus. Under our existing laws, the only way that we can have the appropriate protections to prevent the spread of this virus is via a state of emergency. It is imperfect, and I do not like it. To remedy this, we will be bringing forward legislation to allow this and any future government to implement appropriate measures to manage a pandemic without the need to declare a state of emergency. Once this amended law is drafted, passes both houses of the legislature, and receives its assent from the governor, the cabinet will act for the state of emergency to be revoked, as the new laws will give the government the necessary tools in the case of a pandemic. Bermuda, we have come through the first 2 weeks of shelter in place, a sacrifice that we have all made and a challenge we all have had to overcome. What is most important is that we have shown that we can do this, and we can get through this next 2 weeks. To those of us who have followed the guidelines and stayed home, I am truly grateful. For our people who have lost their jobs due to this virus, many of you have already received help from the government. For those of you who have not yet received the help you need, as quickly as possible. It is not your fault that you are in this position, and we will continue to do all that we can as quickly as we can to support you. We cannot and will not allow bureaucracy and red tape to get in the way. when there are people who may be hungry. We have had companies, charities, and members of our community giving generously and helping to feed people in need during this crisis. And for that, I am grateful. Sadly, there are those who are hoping that we will devolve into political tribalism, devolve into the regular he said, she said nitpicking, name calling, and political games. To them, when our people are healthy and safe, fed and employed, maybe then you can go back to business as usual. But it is my sincere hope that after this period of crisis has passed, we all will have grown and we all will have evolved and we would have been ready to put politics as usual aside. People have died. People are fighting to restore their health this very minute, and we fear that many more of our friends and our family members may also be impacted by this virus. To us, keeping them healthy, protecting our families, and staying focused on the job at hand is more important than politics as usual. We would not turn on each other during a hurricane, so it is important that we do not do this now. Earlier today, in the sitting of the House of Assembly, I pledged to be the best bipartisan premier that I can be, as the most important thing that this country requires right now is unity. For us, this must be the time for unity of purpose, unity of vision, and unity of spirit. And with that, we will all get through this. Thank you, and I'm happy to take any questions.
Evening, sir, and evening, ministers. Yeah, Jonathan Bell from the Raw Gazette. I have my questions here. To begin with, sir, are there construction jobs out there that are priorities to reopen? St. Regis, for example, is one in particular our friends in St. George's wondered about.
Construction is something that was considered, but it is not something that is going to be open during the next 2 weeks of shelter in place. The purpose of the shelter in place is to minimize movement so we can eliminate any possible community transmission or control it as much as possible. And so, or sorry, local transmission. And so for that particular reason, no. You would have seen the Minister of National Security had outlined some changing of the restrictions. These are very narrow changes to restrictions that are only going to be in place on certain days, not the entire week and during certain times. And it's important to recognize that this is only to allow persons who may have planned for 2 weeks of pet food, but now have run out, or persons who may have planned for 2 weeks of doing repairs at home, who may have run out, and those particular things in order for them to have more stuff to be productive at home. But this is not the lifting of the shelter in place. And so in order for us to allow construction to get back to work and things to go back to normal would completely defeat the purpose. And that is not the position of the government.
Thank you, sir. Also from the East End, that's a good one. I mean, we have an airport deal that depends on flights. Obviously, that is completely scuppered at the moment. What can you tell us how, and obviously the airport opening, I'm assuming is going to be much later than we anticipated. Has this affected our deal with ACON? Can you speak with that whole airport arrangement that, as I say, is contingent on flights?
I don't want to speak too deeply on it. I think that everyone knows that contract that was made by the former government, which guarantees revenue to ACON. The government has analyzed these particular items, and I think that in the future we might be able to make a statement on that particularly. But clearly, Jonathan, if there are no flights coming in and there's no airport departure tax being generated, it does put additional pressure on the government due to that deal which was made. But the Minister of Tourism is examining that, and in addition, with the persons at the Bermuda Airport Authority, and I think that in the future, we're able to speak more closely to that. But I know there's been requests for that construction to continue, and the answer is the same as it was for the other construction projects that want to continue. For the next 2 weeks, we are not going to reopen those particular things. We must keep this shelter in place to make sure that we limit any possible community transmission.
Thank you, sir. AG, what you were saying just now really pulled at my heartstrings. I'm going to scrap one of my questions and move over to you. Are you hearing of a spike in domestic abuse? Can you speak of that? We've heard of that happening in other countries. What can you tell us about that?
Thank you, Jonathan. We have figures at this stage. What we're doing is simply monitoring the incidence of calls to us for assistance.
Thank you, ma'am. And now this is one from our readers. So, and I quote, given Bermuda's rate of diabetes and obesity, is the government concerned that shelter in place may be promoting unhealthy sedentary lifestyles? I figured maybe we can talk about expanding exercise times or opening parks or allowing people to swim, perhaps.
I appreciate the question, and I think that it's important to recognize that we allow persons to leave their house for exercise, and persons can exercise in the yard all day or either inside of their house. But the reason why parks are not being open, et cetera, is because when you have shelter in place, you have to focus on how you can enforce that. And if you have different things about parks and people not doing social distancing, you add more places for enforcement. And that defeats the purpose. We've seen those in other countries where they try to do that and rely on short a period as possible. And that is the reason why we've been so restricted. So I would encourage persons, and I think that more people are actually taking out and going for a walk. I think that people are actually bored of being in their house on their phones and are going with their families for a walk. And that is something that is encouraged. And I hope that that is something that continues even after the shelter in place.
Thank you. Mr. Premier, could you expand a little bit on the modeling you referenced? You spoke of a worst case scenario and also a better case scenario, which sees 263 deaths. In order to arrive at these 263 deaths, how many people would have to catch the virus in total, and how many hospitalizations would that be?
I do not have my modeling printout with me, but the Minister of Health has hers. So if you pose the question again, the minister might be able to pull out the slides. I think your question was in
the better case modeling scenario, how many hospitalizations would that be, and how many cases would Bermuda have?
Okay.
Yes, Jonathan. If we were looking at the worst case scenario with respect to the modeling assumptions using a R factor of 2.4, we would be looking at the peak hospitalizations taking place around, and it's broken up in age group. So the height of the hospitalizations with respect to the age group of 70 to 79-year-olds, we would look at a peak date of around the 5th of June. But these are all segregated insofar as the age band. And I don't want to be difficult, but what we did indicate a couple days ago, actually on several occasions, once this modeling has been completed and the epidemiology and surveillance team, as I said, are working with Public Health England as well as Imperial College. Once this is completed, and fingers crossed, we are hoping it will be done by the end of the weekend, we will be making this public, so you'll have an opportunity to review it and then ask any further questions concerning it, because it does contain quite a lot of very, very important information, but it is it's broken up in age bands. So I'm just giving you like a peak for one particular age, but it's broken up into 8 different categories with respect to age. So if I can, I'll try to answer as many questions as you can, but I suspect that next week, once you have an opportunity to have this actually in hand, you'll probably be able to absorb it and then ask more questions. But I can answer as many questions as you have.
Well, let's just take the 70 to 80 age band.
70
then.
to 80?
Yeah, because
Okay.
that seems to be one of the higher ones.
Okay, so for between 70 and 79 years of age, we are looking at the peak of 18 hospital admissions. And at this point, based on the modeling, that would take place around the 5th of June. 80 years old and over, 12 hospitalizations would be the peak, and that would take place around the 31st of May.
Okay.
And that's with respect to hospitalizations.
Thank you very much.
You're welcome.
Minister Keynes. Looking at moving to the grocery store shopping, which always seems to get people excited. Um, On the three-tiered shopping policy, what is the reasoning going 3 days, spreading the people out? And what other jurisdictions?
Actually have to look at other countries, how they're doing it. What we had to look at is at the parliamentary registry. And when we looked at the parliamentary registry, when you get to the Smiths and the Simmonses and that part, there are just tons more people in that part of the alphabet. So when we looked at the parliamentary registry, we were able to segment it a little differently. Mornings I go to the different grocery stores and I see the lines. We believe in making this a little more prescriptive with opening it up to 3 days and less days. We believe that we will have less people at the grocery stores. But specifically, when you look at Sundays, it allows for people that are 55. We made that age a little lower, and people with disabilities and essential workers. And so, what we're trying to do is be balanced, allow people to see that we've been listening, we've been following what people have been saying on social media, and we've opened it up so more people. So there would be smaller names in the surname part, but less days of the week. And we believe that will be more balanced and we will have a better ebb and flow as we go through the next 2 weeks.
Thank you. The two passengers who were hospitalized from the Coral Princess, were they sick when they arrived in Bermuda, or did they become symptomatic on island? And how much contact did they have with fellow passengers or people in Bermuda once they arrived?
I know.
Can you ask the question one more time? It's
Sure.
my fault. I had the minister distracted.
The two passengers who are hospitalized from the Coral Princess, were they sick when they arrived, or did they become symptomatic on island? And how much contact did Bermuda once they arrived?
Just a minute. Provide is that the persons, like I said, it was imported from the cruise ship, and the flight date was on the 8th of April, and the date of their report was on the 16th of April. Insofar as whether they were sick overseas or not, I don't have that information.
All right, thank you very much.
Mhm.
Good evening. Before I begin, I need to apologize for an error I made last night in posting and stating civil servant's name, Mr. Telemack, and I want to apologize for making that error and just staff. My first question to you, sir, is have those tests from the Cayman Islands arrived on island? If they haven't, why not?
The reason that they haven't arrived on island is because they are in London and they'll be on the flight that's coming in on Friday.
Next Friday.
Yes.
Why would you consider, why would the Cayman Islands be selling these test kits if there's a shortage worldwide?
Because I would assume from the conversation which I had with the Premier of the Cayman Islands is what he said is that he wanted to get these test kits, and he had someone inside of his country who wanted to donate a significant amount of money to help the government get those test kits. He needed to order that large volume in order to get to the front of the line so he could actually get them delivered. So that, I think, is the reasoning that he made. And the reason that they're selling them is that there's more than they need. So as I think he's indicated, and I think has been publicized, that some has been sold to Belize and Barbados and Bahamas and other countries. So it works fine. We are going to take an allotment of those, and I, in conversations with the Premier of the Cayman Islands, because we want to make sure that as many of our CARICOM countries who may need additional tests that are having difficulties placing small orders can play a part in that. So we had a conference call of heads of governments of CARICOM on Wednesday, and that I think it's helpful that we're all participating in various things like this together. There are some things which we have, which may be helpful to the Cayman Islands, and which we may be able to supply as well.
Thank you, Mr. Keynes. Electronic stores that service cell phones, would they be considered for roadside service provided?
Can you say that again, Trevor? I actually missed that.
The electronic work in the South End, and this is from one of my viewers, is asking, would any consideration be for these individuals to have a roadside, um,
Not at this point.
not at all. And my last question, since we only have four, a senior officer from the BPS was seen running on the tracks, and I brought this situation to the commission the other day, but further to my investigation on this, this individual was not arrested. A file was sent to the DPP. A decision was made not to charge. TNN understands that a caution, the individual was cautioned, but not go to court. We've had over 20 people charged for breaches. Do you think this is sending a bad message to the people of Bermuda?
So because that was a lot. So you said that a senior officer was seen running through the tracks, and that the senior officer was not charged, and a file was sent to the DPP, and a decision was made not for him not to be charged.
Yeah.
The way our system works, that there is a separation, and so if the DPP makes a decision not to charge someone, that doesn't come in my purview. If it's a matter of operations for the Bermuda Police Service, that is also outside of my purview. The good news tonight is that we have His Excellency the Governor here, and I feel this matters to His Excellency to answer.
Is this microphone working?
Yes, sir.
Thank you. The Minister of National Security is correct that charging decisions are a matter for the DPP. My understanding is that the criminal offences have primarily been for deliberate breaking of the nighttime curfew. Those who have unfortunately been in breach of the daytime shelter-in-place regulations have generally either been dealt with by warnings or, in this instance, a formal caution. So I think this action taken here has been consistent with actions taken for others in similar circumstances.
Absolutely. Thank you very much, Madam Director. What I will say is that over the weekend, we are expecting that we will have more results, which will come in, and they will be posted online. However, the next press conference that will be hosted by the Governor of Bermuda will be next week, Monday. Next week, also, to give some of the hardworking public officers and also the Ministry of Health staff a break, and possibly myself as well. We'll be doing our press conferences on Monday, Wednesday, and Friday. Given the reduction of the number of press conferences, we will certainly allow members of the media to ask more questions when we go into that effect. But what I want to ask everyone to do is to make sure that we continue to pray for our country, pray for those persons who have lost loved ones, keep persons in your thoughts, and also, please, whatever you do, recognize that the changes which have been announced are not going to come in place until Monday. What is in place right now has been in place for the last 2 weeks. And please make sure you obey the rules so we can keep our country safe, help us to continue to flatten this curve, and let us come out of these 2 weeks of shelter in place in a much better space so we can gradually begin to start opening sectors of our economy again. Thank you and have a wonderful weekend.
A message from the Ministry of Health. COVID-19, otherwise known as the novel coronavirus, is changing the way we live,